I will relay now any questions to you from the question and answer. Now, is Rezum suitable for elderly cardiac patients?
Of course, yes, we have elderly patients, and I think it's suitable for them because you need to do it in the outpatient setting.
And it's under local anesthetic, right?
Yeah, and it's local anesthesia.
Yeah, so it would be suitable. Now, what makes Rezum now so different from, say, because see, there are many therapies that use the injection needle and then they inject alcohol, other stuff, heat, cold, whatever, you know? So what makes Rezum different from all that?
Well, I believe because, you know, it is tackling the adenoma by itself. So when you are doing cystoscopy and you're seeing that the adenoma protruding in the urethra, you are tackling that with the high radio frequency.
Can we use it on patients in anticoagulants?
Yes, you can use it with aspirin, but for warfarin, I advise them to stop, or Plavix.
For how long?
Based on the medication. If it is warfarin, like 5 days before the procedure. And
no, afterwards, because there's a necrosis process going on then, huh?
No, usually the bleeding is minimal. So from the next day, they can go back to their regular coagulation.
Okay.
Question.
What is your preferred imaging modality to, it's going away, to estimate the prostate size before Rezum? So on what do you rely for the size?
Well, TRUS is good, as you know. TRUS has more accurate, but if we have like ultrasound also, that will be okay. Because as I said, from my experience, when I did the TRUS and give them patient blockade, I feel first it's uncomfortable for them, and I believe it carry more risk for infection. That's why I just depends on the ultrasound image. And when I do cystoscopy, also I have better evaluation of the prostate size.
No, please. I have two questions for Dr. Khaled. Dr. Khaled, in your daily practice, when you start medication for BPH, when exactly you go to the surgery? This is for the first question. The second one, about the cost of this Rezum technique. It's very important for the private practice.
Mm-hmm. Can you repeat the second question, please?
The cost of the Rezum system. The cost, the price.
The cost.
Yeah.
In my practice, usually when a patient presented and I sit with him and I do all the evaluation, and then I discuss with him the different options. So it depends on the patient. Some patients, they say they hate to be in medication for their long life, you know.
Yeah.
If he's a candidate for watchful waiting, also can be offered for him. To be honest with you, our experience with Rezum is limited. We just started in it. But what I am seeing now, it's promising. The patient like the idea to be in outpatient setting and to have the injection. And when you're telling him that the side effect of, there is no side effect or there is no effect on sexual activity, they like it very much and they are willing to try. Yes. We have a long waiting now for Rezum, but we stop it now, as I said, because of the current situation.
Yeah.
But all of the patients which tried with them, they are happy. They are getting improved. 2 patients, they were in Polis catheter for long term and big prostate, and they are voiding freely now. So all the data available now regarding to Rezum is promising. So the cost, it depends how you will calculate it, and it's vary based on the company. But I would say that the main cost for Rezum is the handle piece, which you use it, the kit. Some countries, they offer the generator like free of charge, that you will buy the kits, like in the States and in Europe as well. Other countries, they just offer you to buy everything. The kits cost varies. It's about, like I say, $2,000, something like that per patient. So if you calculate the cost for this kit, if provided the patient will be free of medication for a long time, so I think it justifies the cost and it's cost effective.
Yeah. You have insurance refund in Qatar?
Sorry?
You have the insurance refund. Insurance. Insurance.
No, we don't have. We don't have yet, but soon we will have it.
No.
Okay, can we use...
As a public, I mean. We have a private company, but we don't have it as a public insurance.
Yeah.
Dr. Khalid, can we use Rezum in patients with penile implant?
No, that's one of the contraindication.
Okay. What's the limit of the prostate volume? Somebody's asking.
Well, the companies, they advise to go, as I said in my presentation, from 30 to 80, but we have experience with 140 and 120 with a good results.
And any data available for the long-term effectiveness, or let's ask how long are the longest data for now?
Well, as far I know that Rezum gets FDA approval last year. So the company, when it started doing the trial, it's almost like 4 years. And most of the people which I met them either from state, Canada, from England, they are happy with the result for about 2 years and 1.5 years. But still, we need to go further with the long-term study.
Okay, now somebody is asking why not to use it over 120 milliliters?
Well, that's a good question. The company, they said go for 80 gram. And when I asked them the same question, why not? Because they said most of the data going on that reference of volume.
Yeah.
But when you go for 120, I believe if you have a huge prostate, patient in severe symptoms, and you want to go with the Rezum, you have to tell him that maybe this medication, this treatment is not enough. You give him a trial and then telling him. That's what I told the 2 patients who came with big prostate and indwelling catheter for a long time. I'm telling them we will give you a trial, but I cannot guarantee you that you will be catheter free. However, after 3 weeks from the procedure, we remove the catheter and they void freely.
So after treatment, do you give any medication like alpha blockers and finasteride until...
Yeah, usually we advise the patient to continue on their regular medication till 1 month. So after 1 month, we stop. So that's our protocol.
What's the percentage of retrograde ejaculation?
Well, in our study, as I said, 2 patients, they complained that, not retrograde, but they said the volume of the ejaculations became less at 3 months. Yeah. So the company, they said 3 to 5%. I am warning my patient. I said maybe up to 10%. You have to consider that your ejaculation might be affected.
Can the procedure be repeated?
Yes, it can.
After what time?
Well, depends on the patient, how happy he is, but of course, not before 3 months.
Not before 3 months, okay. Somebody is asking, can't be used in patients who underwent previous procedures, such as, say, tuna or something. Why?
Because, the tissue and the status of the prostate will be distorted. Even the anatomy, maybe also you are not be aware of it. So it depends on how experienced you are. If you are aware about the anatomy and everything, maybe you can do it. To be honest, one of my patients who had limited TURB because he don't want to have a retrograde ejaculation. So he was not happy. He has big prostate. I offered him Rezum and he is happy with the results.
Good. What about urethral stricture and bladder neck obstruction after Rezum?
Till now, we did not see anything of this.
And in the literature?
And the literature, it's minimal.
So somebody is asking about the complications. So as I understood rightly, the main complication is dysuria, right?
Dysuria has urosepsis after the procedure as well. That you need to be considered.
Okay, so you should have sterile urine before you start.
And in my practice, we keep all the patients in Forest catheter. So if the prostate size is like 30, 40 gram, we keep it for 3 days. If it is huge, like 100 gram, 90 gram, or we can keep it for 1 week or 6 days. If the patient has Foley's catheter earlier, I keep the Foley's for 3 weeks.
Another question, how frequently do you do urodynamics in your patients with LUTS?
It depends how, if he has like comorbidities, if he has chronic disease, diabetes, long-term pelvic surgery. If you are not sure if it is like obstructive or not, then we send them to urodynamic.
Can we apply Rezum in patients with prostate cancer or chronic prostatitis?
Well, there is promising studies about chronic prostatitis, and we are planning also to implement this. But I cannot say yes or no. The studies, it's promising for chronic prostatitis. For prostate cancer, it's not in the indication. However, some doctors, they did Rezum for prostate cancer.
Do you
But as far I know, it's not on the indication for prostate cancer, even for LUTS.
Do you prescribe routinely preoperative, perioperative prophylactic antibiotics?
Yes.
You do, okay. You answered that question already. So last question, how painful do patients find the procedure? Do you give sedation in addition to local anesthetic?
No.
And how long do you keep the catheter as a routine?
To be honest, there is big variation between the patient because, you know, each patient has different threshold. But all patients can, you know, accommodate it. I found it with perineal injection, it's become more comfortable for the patients.
Good. Now, questions keep coming in, but I think we are coming to the end of our time. Is that right, Hara? Hara, can you hear me? Hara?
Yes, sorry. Yes, that's right. We still have 15 minutes actually. So if you would like to talk something else, we have time.
I go on until the questions stop. Is it right that UTI is a common complication with Rezum?
It is. You can consider it as can be because, as I said, it's a necrosis going on after the procedure. So you need to keep the patient in contact with him, and just if he has any symptoms or he develops, then you bring him. As I said, we have one experience with a patient with urosepsis, and that he has Foley's for a long time, and we admit him because he has almost like sepsis. We give him IV antibiotics and keep him for 4 or 5 days.
So then comes the next question. How long do you keep the catheter for routinely in every patient?
At least 3 days.
At least 3 days, okay.
Yeah.
And of course you do a urine culture before the procedure, right?
Yes.
What about the learning curve for the surgeon?
It is, I believe, maybe 4 or 5 cases. You could do it. It's very simple.
So it's simple, huh?
Yeah.
Okay. Another question. Any problem with insurance companies regarding approval?
Well, it's FDA approved. I don't know about the insurance company because, as I said, in Qatar, we are not familiar much with the insurance here. We have private insurance, but we don't have a public, and almost we offer it for our nations free of charge.
So are the private insurances paying for it?
It's a new. I'm not sure about it.
Okay.
As I said, in a region, we use it only in last November.
When is the first review after the procedure?
We call the patient and we take out the catheter in the clinic. And if he passes urine and he's happy, we call him after 1 month from the procedure.
Okay, good. So
for PSA, because you know we are included in the protocol, we'll check the PSA. How is it?
Yeah.
And we found that some patient PSA reduced at 1 month and 3 months, and the other not much change.
Okay.
But that's early because, as I said, we are in the early phase of the study.
But it doesn't go up.
It doesn't go up.
Okay, good. That's all the questions. Now, I want to thank all the panelists for the excellent talks. I found that really interesting, and I hope our participants will agree with that. Now, Dr. Mohsen, I don't know if you're still there and you can hear us, because we couldn't hear you. I'm sorry that it didn't work with the moderation, but I'm sure you enjoyed being part of this as well. Thank you very much to the audience for logging in, and hopefully more on this channel in the future. Assalamu alaikum and Ramadan Kareem.
Alaikum assalam. Thank you.
Salam.